Hello, everyone. So, welcome to Dental Board Reviews. Today's review is on antibiotics. Okay, and so we're going to discuss the beta-lactam antibiotics. So, what are beta-lactam antibiotics? So, these are antibiotics, okay, that also inhibit the activity of beta-lactamase. So they inhibit the activity of beta-lactamase. So you can see where I'm highlighting here. Okay. So the beta-lactamase enzyme. This is an enzyme which is produced by bacteria as a way of resisting antibiotics. Okay. So when antibiotics were introduced, so the bacteria changed their DNA to produce this enzyme to resist the antibiotics. So the beta-lactamase antibiotics, okay, breaks down the beta-lactam ring of the antibiotics. Okay. So the beta-lactam antibiotics, they have a beta-lactam ring in their chemical structure. Okay. All right. Now, what is the mechanism of action for beta-lactam antibiotics? So, the way the beta-lactam antibiotics work is that they covalently, okay, remember the key word, covalently, not ionically, okay? They covalently bind the penicillin binding proteins. So the penicillin binding proteins, these are enzymes which are necessary for cross-linking, okay, of the peptidoglycan of the cell wall, of the bacterial cell wall. Okay, remember the cell wall is made out of bacteria, is made out of peptidoglycan. Okay, so beta-lactam antibiotics, because they stop the synthesis of the cell wall. So if the bacteria cannot make a wall around themselves, they die. Okay, so what we call bactericidal. So these antibiotics, the beta-lactam antibiotics, are bactericidal. The opposite of that is bacteriostatic, meaning they just stop the bacteriostatic antibiotics. They stop, okay, the growth of bacteria. And then when the bacteria is not growing, so our immune system comes in and actually ingests and removes those bacteria from the system. However, bactericidal antibiotics, such as beta-lactam antibiotics, they kill the bacteria instantly. So they are bactericidal. Okay. So this is a beta-lactam ring. Okay. And so a beta-lactam ring is a cyclic, okay, cyclic amide. So not a cycline, it's supposed to be a C here, cyclic as a secular. Okay, so you can see it's closed, it's a closed ring, and it's an amide because it has a nitrogen attached, right? So it has a nitrogen attached to it. All right, so the nitrogen is attached to the beta carbon. All right, so the function of the beta-lactamase enzyme that is produced by the bacteria is to hydrolyze, break down the beta-lactam ring. So to break down this ring. Okay, so once it breaks down this ring, the antibiotic is no longer active. Okay, so the beta-lactamase enzyme, remember, this enzyme is produced by bacteria to stop the action of antibiotics. Okay, so they are fighting the antibiotics by using the beta-lactamase enzyme. Okay, and we're going to see how you can avoid the antibiotics from being broken down by the beta lactamase enzyme. Okay. So, what are examples of beta lactam antibiotics? So we have the most common ones, the penicillins. Okay, the penicillins. So the classes, the most common is amoxicillin. Okay, and some hospitals do use ampicillin. Okay, and we have also Piperacillin. Okay, piperacillin is very common as a broad spectrum for infection. However, it's available IV. Okay, and then we have cephalosporins. Okay, the most common one is Keflex, which is cephalexin. All right, they used to say that if you're allergic to penicillin, then you may have some allergy to cephalosporin. But this allergy, it used to be estimated at 10%. Now, this estimation is about 2 to 3%. So, if you're allergic to penicillin, you can still prescribe cephalosporins because the percentage of patients who are allergic to cephalosporins when they are allergic to penicillin, so it's very low. It's about 2 to 3%. Okay, so if patient is allergic to penicillin, you can go ahead and give cephalosporins. Okay, and we also have cephamycins, and these work really well with infections such as those with staph, MRSA, so methicillin resistant staph. These they work. Okay, and you also have cefoxytin. Okay, carbapenems work well with resistant bacteria. As I mentioned before. Okay, and the good thing about this, they can be given once a day. Okay, so these are beta lactam antibiotics. These are the most popular antibiotics in the United States. Actually, I think around the world too, the penicillins. And we have to be cautious in terms of when we're prescribing them so that the patient doesn't develop resistance. Okay, because remember, these antibiotics were they were discovered in the 50s. Okay, so they've been around only a few 50 years is still a short period of time. So that means your grandpa, really, when penicillin was coming around, was some very new technology in medicine. So we have to take care of the antibiotics and make sure we prescribe them cautiously to prevent resistance. So these are the examples of some carbapenems. Remember, carbapenems are very good antibiotics. Okay. And the good thing is they can be taken once a day. Okay, so compliance is very good. So what are some beta lactam enzyme inhibitors? Remember, I told you that the beta lactamase is produced by the bacteria so that it can stop the action of the antibiotics. Okay, so the way the pharmaceuticals have done it now, when they're making some of these medications, okay, so they can add beta lactamase enzyme inhibitors. Okay, so these enzymes, they prevent the breakdown, the hydrolysis of beta lactam ring. Okay. Remember, the beta lactam ring is the one which is going to allow the binding of the protein binding site, penicillin binding site, and then preventing the synthesis, the cross-linking of peptidoglycan for the synthesis of cell wall. So there's no cell wall synthesis, and then this bacteria dies. So we have clavulanic acid, okay, which is also clavulonate, and then you have sulbactam and tazobactam. Okay, so if you add amoxicillin plus clavulonic acid, we get augmentin. If you take ampicillin and you add sulbactam, then you get what we call unison. If you take piperacillin, the one I said earlier that is given IV and it's a broad spectrum, very good antibiotics, then if you add tazobactam, you get what we call zosine. And these are very good antibiotics which are given most of the time for different kind of infections in the hospital, so IV. Okay. Now, the thing about the beta-lactam enzyme inhibitors is that you have to consider the kidney function. Okay, the kidney function of the patient. Okay, because these can be nephrotoxic. Okay, so always keep that in mind. So remember, if you haven't subscribed to Dental Board Reviews, go ahead and subscribe. Okay, and you can go through other microbiology videos too, lectures for your own review. Okay, if you have any questions, comment or email me with any questions. Okay, so some examples of antibiotics that are combined with beta-lactam inhibitors, which I mentioned in the previous slide. So we have augmentin, which is amoxicillin clavulonic acid, unison, ampicillin, sulbactam, and zosine is piperacillin with tazobactam. Okay? All right. Again, as I said, subscribe so you can get these short reviews of the concepts. Okay? You take care.